Buckle up for a deep dive into AI in healthcare.
Oh, yeah, this is going to be good.
You bet. You've given us a whole mountain of research here.
Yeah, we've got reports, articles, even testimony to Congress.
PwC, Siemens, managed healthcare executive, the works.
And this fascinating stuff.
It really is. AI is already changing healthcare in so many ways.
From how doctors diagnose and treat to how new drugs are discovered.
Exactly. That's exactly what we're going to unpack today.
We'll definitely have to touch on the challenges too, though.
Absolutely. But first, one thing that really jumped out at me was this idea of AI as like a superpowered assistant.
Right, like for doctors and researchers.
Yeah, PwC talks about how AI can take over all those repetitive tasks in drug discovery.
Like all that data entry and analysis that takes up so much time.
I can't even imagine.
But think about it. If AI can do all that, researchers can actually use their brains for the hard stuff.
Focus on the big picture, the creative problem solving.
Exactly, and it's not just in the lab either.
Oh, right. The House testimony mentioned AI tools to help nurses with those crazy shift handoffs.
Oh man, shift changes in a hospital are insane.
Can you imagine trying to communicate all those critical details about a patient?
In all that chaos, no way.
It's no wonder there's so much burnout.
And mistakes happen too.
But with AI stepping in, those handoffs could be way smoother.
Less stress for nurses and definitely better care for patients.
Imagine if your loved one was being cared for by nurses who were more focused and less overwhelmed.
That's what we want.
Absolutely. And speaking of better care, we got to talk about AI and diagnosis.
Oh yeah, AI is changing the game there.
The Managed Healthcare Executive article talked about the golden hour for stroke patients.
Right, that critical window where getting treatment fast can make all the difference.
But radiologists are often drowning in images, right?
So much to review, and every minute counts.
And AI can analyze those images so much faster than a human can.
It's incredible. It can flag potential strokes instantly, getting patients the care they need ASAP.
We're talking about saving lives here.
Literally. Shaving off critical minutes in the diagnosis process.
It's amazing. And there was that testimony from UC San Diego about an AI tool that spotted COVID pneumonia on an X-ray.
Oh wow, the one that human doctors missed.
Yeah, and because the AI caught it early, the patient got treatment faster and had a better outcome.
See, this is what I'm talking about. AI isn't just assisting doctors. It's making them better at what they do.
Okay, now let's shift gears to drug discovery.
Okay, hit me with it.
The Managed Healthcare Executive article really dives deep into how AI is revolutionizing research.
It's like having a superpowered research assistant, right?
Right. Jackie Hunter, a pharma exec, talks about how AI is helping scientists make sense of mountains of data.
There's just so much information out there. It's beyond what humans can handle.
But AI can sift through it all.
Identify potential drug targets, even simulate how different compounds might behave.
It's like having a 204/7 research team, constantly analyzing and uncovering hidden patterns.
And that means new treatments could be developed way faster.
They gave an example of AI identifying potential COVID-19 drug targets.
Oh yeah, instead of testing thousands of compounds, AI narrowed it down to just 60.
Can you imagine how much time and money that saved?
And it could be applied to any disease, potentially leading to faster cures and more effective treatments.
This is getting me really excited about the future of healthcare.
Me too.
Yeah.
But we got to be realistic. There are challenges too.
Like data privacy, right? That's a big one.
Huge. Especially when you think about all the personal health data these AI systems rely on.
The House testimony brought up some concerns about those consumer health apps.
Right, the ones that aren't subject to the same privacy rules as regular healthcare providers.
Like iPay, the law that protects your health information in traditional settings.
So many of those apps collect tons of personal data.
And people might not even realize how it's being used or who has access to it.
It's a good question mark.
It makes you think, do patients really understand what they're agreeing to when they use those apps?
And who's responsible for protecting that sensitive information?
It's complicated.
Definitely. And it's just one piece of the ethical puzzle surrounding AI in healthcare.
We've got a lot more to unpack there.
We do, but maybe let's dive into those ethical considerations a bit more next time.
Sounds like a plan.
Tune in every week for insightful discussions and mind-bending ideas.
All right, see you then.
See ya. So we were just discussing how those health apps might not be covered by IP.
Yeah, that's a little scary, right?
A bit. I mean, I use those apps all the time to track my sleep and steps and everything.
I do too. Makes you wonder where all that data is going,
Exactly. And who has access to it?
especially now with AI and healthcare relying on so much data.
So how does that actually work? Like, how does the AI learn from all that data?
Well, think of AI like, like a student learning a new subject.
Okay, I can see
They have
that.
to study a ton of examples, right?
To really understand the material.
It's the same with AI. We train it using these huge data sets.
So the AI looks for patterns in the data.
Yeah. And from those patterns, it learns to make predictions.
So if the data is messed up, the AI's predictions will be messed up too.
Exactly. Like garbage in, garbage out.
That makes sense.
That's why data quality is so important for AI in healthcare.
We need to make sure it's accurate and unbiased,
Otherwise, the AI could actually make existing health disparities worse.
or even create new ones. Yikes.
Exactly. But even with good data, there's still a chance for bias to sneak in.
Oh, right, because humans are the ones designing these AI systems.
Right, even with the best intentions. Human biases can kind of like seep into the design.
Oh, I see.
Like when we decide which factors to include in the algorithm.
Or how much weight to give each factor.
Exactly. And how we interpret the results. All of that can reflect our own biases without us even realizing it.
So it's not enough to just focus on making the AI technically sophisticated
Nope. We have to be super aware of those potential biases.
and actively work to minimize them.
Absolutely. That's why we need diverse teams working on this stuff.
People with different perspectives and backgrounds.
Right. And clear ethical guidelines to make sure the AI is being developed responsibly.
Which brings us back to those ethical considerations we were talking about.
That's a whole other can of worms.
It is. So where do we even start with addressing all these challenges?
Well, one big step is transparency.
What do you mean?
We need to be able to see how the AI is making its decisions.
Especially when those decisions are about our health.
Right. It's not enough to just say, the AI recommended this.
We need to know why.
Exactly. Like, show your work, AI.
So we can understand the reasoning behind the recommendations.
And make sure it's actually making sense. Transparency helps build trust.
Makes sense. So transparency is key. What else?
Accountability is another big one.
Like, who's responsible if the AI messes up?
Right. Especially in healthcare, where the stakes are so high.
Is it the people who made the AI? The doctors using it?
It could be any of them. Or even the hospitals or companies using the AI.
So we need to figure out who's responsible for what.
And make sure there are ways to address any harm that might happen.
Sounds like we need a whole new set of rules for the AI age.
We do, both legal and ethical.
And it's not just about rules, is it?
Nope, it's about creating a culture of responsibility
Where everyone involved with AI understands the ethical implications.
and prioritizes patient safety above all else.
And I think education is a big part of that.
Totally. Not just for doctors and developers, but for everyone.
The more people understand about AI, the better.
Right. Then they can participate in these important conversations.
And advocate for responsible use of AI in healthcare.
We need everyone at the table for this one.
This has been such a great discussion.
It really has. It's complex stuff, but fascinating too.
We've covered so much ground, from data privacy to bias to ethical frameworks.
And the need for transparency and accountability.
It's a lot to take in, but it's important.
Yeah, we can't just ignore these issues.
Yeah.
But we also don't want to be scared of AI.
Right, because it has so much potential to improve healthcare.
It could help us diagnose diseases earlier, find new treatments faster.
And provide more personalized care, which is actually what we'll be diving into next. Okay, so we're back and ready to tackle this idea of AI-powered personalized medicine.
This is where it gets really exciting.
Right, like imagine a world where treatments are tailored to your specific needs.
Your genes, your lifestyle, everything. It's like custom-made healthcare.
Exactly. And what I find fascinating is the potential to predict not just your risk of getting sick, but also how you'll respond to different treatments.
Oh yeah, that's huge. Knowing beforehand if a drug is likely to work for you.
That would totally change the game. No more trial and error, just targeted treatment.
It could make treatments so much more effective, with fewer side effects too.
And ultimately, better outcomes for patients. That's what we all want.
For sure. But, you know, we got to be realistic. AI isn't perfect.
Right. It has limitations.
It's still a work in progress. So we can't overhype it or make promises we can't keep.
So it's more about using AI to help doctors and patients make better decisions.
Exactly. Not replacing human judgment altogether, just informing it.
So the doctor-patient relationship is still crucial.
Absolutely. AI is just another tool in the toolbox, providing valuable data to help guide the conversation.
I see. That makes sense. But I can't help but wonder about the downsides of knowing so much about your potential health risks.
Oh, you mean like, could it create unnecessary anxiety?
Yeah, exactly. What if you're told you have a high chance of developing a certain disease, even if you're perfectly healthy now?
That could be really stressful.
And maybe even lead to people getting treatments they don't really need.
That's a valid concern. It's something we have to be really careful about.
Like, the anxiety itself could end up harming your health.
It's a tricky balance, for sure. We need to make sure patients are informed and supported when they get this kind of information.
So they can make rational decisions without freaking out.
Right. And it highlights the need for more open communication about AI in healthcare.
We need to have those conversations now, before things get too far ahead of us.
I agree. Patients, doctors, researchers, policymakers, everyone needs to be involved.
This deep dive has been quite the journey. We've covered a ton of ground.
It's been a whirlwind. From diagnosis to treatment to drug discovery, AI is shaking things up everywhere.
And we talked about the big ethical challenges like data privacy and bias.
Those are crucial considerations. We can't just ignore them.
But amidst all that, it's important to remember the potential AI has to make healthcare so much better.
Absolutely. Earlier diagnoses, faster treatments, more personalized care. The possibilities are endless.
I think our listeners have a lot to think about after this deep dive.
They definitely do. We've given them a lot to chew on, that's for sure.
But hopefully it sparks some important conversations.
I hope so. Because this is a conversation that needs to happen.
The future of healthcare is being shaped right now, and we all have a role to play.
So keep learning, keep asking questions, and keep pushing for responsible AI development.
That's a great message to end on. Thanks for joining us on this deep dive into AI in healthcare.
It's been a pleasure.
Until next time, stay curious.
Subscribe to AiRev on your favorite podcast platform, and let's revolutionize the future together.